Cook County Health is proud to provide the latest in procedures and advancements in care to our patients. Our historic mission means we believe that everyone deserves access to high-quality care regardless of their circumstances.
I think Cook County is very uniquely positioned. It's one of the only few safety net hospitals in the country of United States that is able to offer this advanced procedure called TAVR. We are able to offer this to any patient walking into our doors, irrespective of their ability to pay. We are bridging the disparity in healthcare that we see in Cook County every day. TAVR stands for transcatheter aortic valve implantation or replacement. The procedure is a minimally invasive procedure in which we replace a diseased valve with a functioning valve in a beating heart. It's a procedure done under general anesthesia, but it's minimally invasive so the patients are able to quickly return to their activities and are able to go home within 48 hours.
I could probably walk a half a block without having to stop, and it was like an acid reflex burning in my chest. All this was just burning like it was on fire, and I couldn't walk.
Miss Jones, when she came to us, was so symptomatic that she was not able to do any of her activities on her own.
I'm able to do the things I was doing prior to me feeling so, weak and tired and no energy to go anywhere. Now I get up, do what I have to do, go home and enjoy being at home, and I'm just loving it. It truly feels great. It really does.
Being able to provide this type of care to our patients exemplifies the work Cook County Health is doing to ensure our patients can live their fullest life.
If I could say one thing to Dr. Zaney, that's thank you. Thank you very, very much. I truly mean that.
In our ongoing effort to ensure that we're providing equitable health care, it has been important to address social risk factors that impact that. Of course, those social risk factors include everything from transportation, food insecurity, but we have really focused by way of the Respite Center on housing insecurity. The RISE Center has created a unique opportunity to go beyond just healthcare in the four walls of the hospital.
The purpose of medical respite is to find temporary housing for people that are recuperating from medical procedures or illnesses. They come here so that they can have a place to rest and recuperate and get wraparound services. That includes nurses, medical assistants, and case managers to not only help them with their medical issues, but also to help them procure stable housing.
Imagine being discharged from a hospital after an acute illness without people who care about you, without transportation to be able to make it to outpatient appointments, without adequate food, and clothing, and without a roof over your head. It's pretty intuitive what a challenging experience that could be.
I've been homeless since 2010. My mom passed away, things just basically fell apart for me. And this has been a blessing, it really has. I've been able to reconnect with my family, my daughter, my sister, and they've been there for me. Excuse me. I've been able to regain my health. It's not to full capacity yet, but I'm getting there. This is the place that saved my life. It's that simple.
Cook County Health is proud to have a diverse workforce that lives in and is reflective of the communities we serve. As we continue to build our expert team, we are finding creative ways to recruit top talent in a competitive job market. Over the past year, Cook County Health has held nearly 20 large-scale job fairs. And to compete with other health systems, we are offering recruiting bonuses for select positions. These strategies have led to over 100 external hires who have joined Cook County Health, where the recruiting bonuses have been applied, in addition to an increased number of external hires month after month. We're very proud of this accomplishment.
We are committed to making Cook County Health an employer of choice, we also want to make sure we are looking forward to future generations.
In 2022, with support from the Cook County Health Foundation and Cook County government, we launched the Provident Hospital Scholarship Fund, which is now providing financial assistance to over 30 students pursuing educational paths in the medical and dental fields from underserved communities.
It's essential that we lift up students, such as you in this room, and that you lend your talents to underserved communities. It's the right thing to do for the nation's healthcare workforce and the right thing to do for our Cook County Health patients.
We will continue to recruit to ensure diverse staff who reflect the patients we serve. Doing so also allows us to provide culturally competent and high-quality care.
As a government-sponsored health system, it is essential that we operate efficiently in order to serve as many people as possible. The allocation of taxpayer funds to Cook County Health overwhelmingly supports our public health department, the provision of correctional health, the modernization of our facilities, and expansion of our services. I am proud that our health system is largely financially self-sustaining, and we have ended recent years with a positive operating margin. We have improved our cash collections as part of our revenue cycle turnaround plan. The payments we were able to collect help us fund our CareLink program that provides free or discounted care to patients in need.
Yo decía, ¿cómo voy a tener un doctor si no tengo un seguro médico? Entonces, con este programa, con esta ayuda, es como si yo me siento que lo tengo todo. Tengo doctor de cabecera. También he tenido más problemas de salud y la verdad como que fue una ayuda, como que si Dios puso ese programa en mi camino porque he tenido que estar visitando al hospital y todo me lo ha cubrido.
Our two hospitals provide nearly half of all the charity care provided by all hospitals in Cook County. Our ability to be fiscally resilient ensures that we can continue to care for all, regardless of ability to pay, and remain an essential community asset.
Cook County Health's goal is to be a provider of choice. Enhancing our facilities is one part of our larger strategy to provide high-quality, patient-centered care in the neighborhoods where our patients live and work. As more and more patients get health coverage, they have new options for care, and we hope that they will choose Cook County Health.
We are committed to modernized facilities to ensure that each one of our patients, regardless of who they are, what they look like, what zip code they live in, what language they speak, receive the highest quality care.
Modern and bright healthcare facilities can improve patient flow, foster trust, and trigger endorphins, which reduce anxiety. They create an overall positive experience that helps improve clinical outcomes.
Each one of our modernized facilities is a patient-centered medical home. What that means is every one of our patients is welcomed. We define that welcome in the facility by how it looks, the colors that we put, community murals that we put on the walls. All of that creates an ambiance of making a patient feel welcome.
It is an honor and a privilege to serve our patients, and we are continuing to make investments in our facilities to ensure that they match the high caliber of care we provide.
When COVID-19 vaccines became available, Cook County Health knew immediately we would need to find a way to provide large-scale access to vaccines, not just for our patients, but for Cook County as a whole.
We promised every resident who wanted a vaccine would be able to get one, and that special attention would be given to be sure that we reached our most vulnerable residents. I'm very proud to say that we fulfilled that promise. Reaching this milestone is a testament to the faith and trust residents have in Cook County Health and in science more broadly.
We are committed to a program grounded in equitable distribution of the vaccine to ensure that our most vulnerable and the areas most impacted by COVID have access to the vaccine.
Setting up mass vaccination sites in central locations throughout Cook County took the work of an incredible team at the health system, from ambulatory to IT to pharmacy and beyond. It also included enormous support from our partners at Cook County government, the Illinois National Guard, and other government agencies and community partners. One major step in the vaccine distribution was the development of a website to provide information and appointment sign-up for residents. The day we launched, there were over 1 million hits to the website and 18,000 vaccine appointments made in the first week. We were also cognizant of the fact that we needed a call center to assist patients without computer access and offer support in multiple languages. With a focus on equity, CCH and the Cook County Department of Public Health hosted hundreds of hyperlocal vaccine clinics to meet people where they were and created a public education campaign that has won more than a dozen awards. Cook County Health has given out more than 1 million doses of COVID vaccine and showed how effectively our health system can work together with our government and community partners.
For nearly 200 years, Cook County Health has been evolving to meet the needs of our patients and communities, and we are continuing our evolution today.
Provident Hospital's roots go back to 1891, when it was opened as the first Black-owned and operated hospital in the country. While it has been through a lot since then, I am proud to say that we are rejuvenating this treasured, historic community hospital. In recent years, we have invested more than $8 million to modernize Provident. We upgraded our emergency department, expanded our med-surg beds, reopened the intensive care unit, installed a new MRI, opened a new outpatient dialysis center, and welcomed back ambulance runs. This year, we will be enhancing our surgical services and bringing on board more specialists to expand access to care right here on the South Side.
At Stroger Hospital, we opened a neuro ICU and a new 10-bed med-surg unit. There is a new clinical decision unit to help us monitor and quickly admit and discharge patients in observation. We are also doing a complete overhaul of our wayfinding system. Across the system, we are strengthening our behavioral health services and partnering with other providers to build more capacity. With a focus on access and equity, we are expanding our services to meet the health needs of people in the communities where they live.